Good afternoon. Thank you for your time today. My name is Kristen Schutz, and I have a master's in education with Inclusive Classroom, and I am from Citrus County, Florida. Fairly new to this state, have only been here about a year. These are my colleagues. Andrea Fryer of Seminole County. Her son is an honorary ambassador of Easter Seals of Central Florida. Emily Starnes of Seminole County, and she is a member of the Soto Syndrome Support Association and is a self-advocate. We have Lydia Asio Stoutenberg of Broward County and is a board member for Parent to Parent of Miami. We are here today to request your help in developing a task force that will be the rite of passage, bridging the gap of adult-oriented care. You will learn every individual with disabilities struggles to find comprehensive health care once they are out of pediatrics. There is no coordination of care between pediatric and adult providers.
Imagine going to the doctor. You've waited a couple months, done all the steps that you needed to do to make sure everything was in place, and you go into the room and the doctor looks at you and says, "I'm not comfortable treating your son." And then tells you, "Don't worry about it though, we won't charge you." When I have no medications, they say, "Well, take them to the emergency room. Maybe they'll write it." You go home, you call other doctors, and you don't even get past the word autism before they say, "No, we would rather not." Currently, there is no requirement for any physicians to have any kind of training. And so if you're leaving the pediatric world, it's almost impossible. I finally found a primary care, but it was through calling a case manager for the insurance, and she had to call around to different offices to find out who would want to take my child. Even with knowing that most of the illnesses that they would treat are stuff they would normally treat with anybody else without the disability.
Hello there. As Kristen said, I am a person with Soto syndrome, which is similar to Asperger's and other high-functioning autism spectrum disorders. My family, when I got diagnosed at the age of 2 months, knew how to plan. They made it so that I could have whatever accommodations necessary, and I needed to have a successful life, and so far I have. However, when I was in high school, I wanted to have more conclusive evidence via genetic testing that I did have Soto syndrome, which again, I was confirmed at the age of 2 months. I definitely did, but it's just a safety net, you know? When I got there to a highly reputable geneticist, she, along with my insurance provider, said that I could not get conclusive testing because, and I quote, "I wasn't sexually active and married and therefore wouldn't need it." It doesn't make sense to me because if I wanted to have a family, I want to plan to have a family before I actually have a family and a kid, just so I can know what to expect in case I have a 50% chance of passing down my genetic condition to my child, or not. So the fact that insurance companies and medical professionals are withholding that sort of information from me by means of red tape and politics is an injustice that myself and probably other families with genetic conditions most likely face, and it should stop right now. Thank you for your consideration.
Good afternoon. So what are we talking about here? Are we talking about something extraordinary? We're talking about equity. We're talking about access. We're talking about the same kind of care delivery we would want to give to our young children. We have that as parents of children with disabilities. We struggle to find developmental pediatricians. When we do that, we would like that care to be transferred to an adult provider. So what are we facing here? Not just across the state of Florida, but nationwide. We have a crisis, a shortage of providers for adult medical care for people with developmental disabilities. What is the source of this problem? It's fear. Fear that they're not going to be able to handle the situation. Fear that they don't receive the right training. Fear that they're going to be bombarded and their waiting rooms and offices are filled with people with disabilities. We can't work with fear. What we can work with is a solution. By the year 2030, we will have 750,000 people with developmental disabilities transitioning into adult care. So we'd be able to provide a solution for them. We can't have our ERs filled. We can't have people going without medical care if we're talking about equal access. So what is our solution? The continued medical education provides from nearly 12 to 50 hours of additional training to become certified. That's not a great deal. So what we propose is a model based on what Pennsylvania's initiatives have proposed, which is a mandated training for practitioners, which would include nurses, physicians, nurse practitioners, and other providers for people with developmental disabilities. Right now, there is no mandated training. Right now, on the Developmental Disabilities website of Florida, there are webinars that are available for nurse practitioners and physicians. However, this is, again, an elective thing to do. But we want to provide some comprehensive training so that at least we have the foundation for our providers to be trained to take care of our young adults. How can we do that? We can do that by providing incentives. So for one, to provide this mandated training from residency, and that can be both clinical and didactic. So in other words, not are they learning the textbook work, but also having some clinical practice with people with disabilities. Some practitioners have never treated someone with a developmental disability. And to not have that support, to not have that transfer of care, it's hard to receive these pediatric patients. We can sympathize. However, we have to work together to find a solution. So we propose to come up with a comprehensive task force. On this task force, Florida will take the lead to develop a committee that is dedicated to training providers. How can we do that? What would inspire someone to go into this specialization? Well, we need to provide some incentives. Maybe that could be in the form of loan repayment. That seems to work for education, as we have many repayment options for loans. Perhaps that would inspire people to go into this practice. Another thing we can do is provide ongoing support so that we can have a coordination of care between pediatric and adult care. A seamless transition. We don't want any interruptions. Another thing we can do is make sure that this stays affordable. A lot of our physicians have stated that it's very difficult to provide the extra care when you're being given the same amount of money. So let's make sure that that is an affordable option for both the patient and for the provider. We can see that this can work if we implement this task force, as we've named it, the right to passage. And I emphasize RIGHT, because that is the right of every person with a developmental disability or not, to have adequate, comprehensive, developmentally appropriate care. Let's not just talk the talk, but let's walk the walk. Thank you.